Hey guys, it's Dr. Emer. We're doing one of my favorite treatments today, male facial sculpting. And I have a patient here of mine that has a couple things going on that we want to address. He actually shaved for the first time in many years. So now we're able to see all the areas of his face where we want to contour, where we want to optimize. So some of the areas, especially as you either get older or you lose weight, you lose volume in this middle face, so then the folds become more prominent. The lower part of the face becomes more square or rectangular versus and then also this temple area, he happens to have some scarring. You can see some of the deep scarring here, but that area tends to lose volume, which is why the brows and so the forehead kind of come down. So my goal today with the fillers is to just square off his cheek a little bit. It's always going to look a little overdone that day. In the next week or so, that will settle down, look more natural. We're going to do the temple area, little on jawline, little on chin, and the folds, so that we can just improve overall. I'm going to use first my structural filler. Oh, and then one of the things he pointed out too was his necklines. Now we're going to be lasering. He also just did a peel, so he improved a lot. I'm going to actually use a filler on here today to fill out some of the necklines for you guys, so you can learn what we can do for what we call tech neck, because people are always looking down nowadays and it worsens. But he also has looseness if we ever do something where it lifts, even when you lift, look, you can still see those wrinkles. So lasering, when we start to laser, and also fillers will help. So we're gonna start initially at the top. We're gonna work our way in the temple. This is a weird feeling, I always tell it to people, but it's a very safe plane. Not too bad, right?
How does that feel?
It feels okay.
Yeah, I tell people it's weird, and sometimes people say they can hear it, they feel like it's going into their brain. But it's not doing that. It's not.
I almost feel like an electrical thing more than a needle. But yeah, it's not painful.
Good. So we're gonna go, always go nice and slow.
My lips are so numb I can barely talk.
We like that, that's good.
In what city are we working, guys? We are West Hollywood, California, United States.
Now we're also going to do his lips today, because as you age, the upper lip, especially in guys, really becomes very non-existent. It starts to come down, and the mouth itself kind of caves in and collapses, so you lose volume here. We're going to work on addressing some of that with filler. You can't do everything with filler, unfortunately, but we do our best. Now we're going to go to the opposite side. So he did really well there. There's numbing inside of this. The other thing is, I actually sent my team a video last night about the tear trough area. This area tends to get more noticeable as people get older, but honestly, it's really the number one thing that I find young people come in for now is dark circles or tiredness around the eye. And filler is not the most important thing here. We're going to do a little, but there's a tendon that connects us here, and if you inject above that tendon, often the area can look really swollen. So we don't want that to happen. So I'll show you guys a technique. But here we are going onto the temple area, and he has, again, some scarring here, so this will actually help it, improve it, without even directly injecting the scar. But we're going to do that anyways. Okay, there.
You can change it. Go. All right. There's 3 temporal arteries and 3 veins. What is your thoughts on injecting radius non-reversible filler without aspiration?
So I do this every day for 15 years. If you guys want to see my videos, you can see in this area there is no arteries or veins. So if you know anatomy, we're deep enough, we're underneath them. And on medical boards, they go through every layer of the temple and how to address it. And I know this because I was a skin cancer surgeon.
Dr. Emer, what do you use for eye bags?
Well, there's a lot of different things for that. A lot of different choices. Lasers, we end up using more lasers. We end up doing more lasers than we do filler nowadays. You can see already the scarring improved a little bit, but I still want a little bit more. So we're going to go a little bit closer right onto bone, give him a little more volume here on the edge of the brow. So he really needs that. You see this all filling out. we're a little more superficial, we would worry, look at how the improvement there. Really good, that's okay. Really good, make sure you don't take off here.
How does our patient feel so far?
Good, I didn't even feel those last two.
We can already see a big improvement in the hollows of the temples. So this must be a doctor. So what specific landmarks, or you hit bone to be safe?
Well, I'm not gonna go through teaching. This isn't a teaching thing. It's for you guys to just watch.
Educate a little bit.
I can't go through how to inject. But if you wanna learn, let us know. We can work something out. So here we are filling this area because he had a lot of volume loss here. You see, really more than on this side. Oh, no, don't take anything out. And so this volume, for some reason on this side, if you look here, it's more filled out on his brow. He just needed more, so we're working to build that. And this is why you kind of watch and you see. You can see even if I pull back, look, nothing happens. So this is going to actually elevate his brow, but also fill out the scars.
Do you need to come in?
I'm gonna switch sides.
So now I'm going to go next to the cheek area and then the chin. And again, like I said, sometimes that looks really good. You can't see as much, a little bit more. Here, by lifting here, we'll be able to improve his fold. But the other important thing is we're going under the tear trough and the specific tear trough ligament so that we get more lifting without looking overdone. And we always want to do, Ben, a more horizontal approach rather than vertical or lateral, because that looks feminine. Actually, we had a patient today that just came in who was injected elsewhere on the corner and looks very female, so we had to reverse it. You don't want to do that.
No, I don't want that.
No.
All right, Dr. Emer, the twins from Key West want to say hi to you.
Oh my God, the twins from Key West. Where have they been? Ask them to come back. They did lives with you, Jordan.
They did?
Yes, they did lives with you. One did facial sculpting. The other did something else that I wanted to say right now. I'm here.
All right, guys, come back and see us again.
I would love to see it. We miss you guys. Come on back. So he did the same thing as you. Actually, one of the guys. He did full facial sculpting, and he had, again, a chin that he didn't even know was needed volume. And then when we did it, he was shocked at the difference. Which is with you, you actually have good volume. You're just losing a little bit on the sides. That's why this lip corners are coming down. So what I'm going to do first is go deeper on bone and give the lip mouth area some structure. That's going to hold this area. And then we're going to give it superficial support around the mouth.
Someone is asking, how would you manage a VO with radius in the temple?
Say that again.
How would you manage a VO with radius in the temple?
Well, let's not worry about that. So they're talking about complications. Let's not worry about a complication right now. Let's worry about success.
They have underscore aesthetics. They're probably an injector.
Yeah. Again, that's an educational learning thing.
You guys can DM if you do need some learning, some teaching. Dr. Emer can help you out. You can send us a DM, and we can get in contact with you.
Great. So you guys can see the chin. It's really getting built out.
That's what I need. I've always had a weak chin.
Well, it's gonna look great.
Dr. Emer, someone's asking if we have treatments to reduce pore size. Yes, we do. We have several different things.
So,
We have treatments here. We have stuff online that you can buy. If you can't see us, you can go to emercosmetics.com.
my Aerify kit's a good at-home treatment. You could do derma rolling at home. In the office, we actually really like to do things like clear and brilliant and other lighter lasers. So here's what I'm gonna do. This is very different than training, those that have been training. So this is called the lower cutaneous lip. We're gonna work and do some little threads here along the marionette area, lower cutaneous lip, to just kind of three-dimensionally build the chin. Hurts a little bit, I'm sorry, but we're going to just kind of soften this. It also will improve the scars and the lip corners.
All right, would jawline Botox be an alternative for him too?
Not really, because that's gonna make his face sag more. So yes,
Don't
you
want
could
that.
do it, but we don't want him to sag.
All right, guys, so let's see, what are we doing, guys? We are doing male facial sculpting. We've done his temples, we've done his cheeks, we are doing the chin now.
Now, we only did one side of the cheek. Only did this one so far. Just FYI, in case you guys notice the difference. Again, doing little baby threads. He has thicker skin here. So we want to kind of subside some of these scars. Give him a little structure in this pre-jowl area. And this will help. Very good. Look all the way up a little bit. So a lot of times when you pinch here, if the volume, if it caves in a little, it needs volume. So we're going to do a little bit of volume in the marionette here.
Does chin fillers help with a double chin?
It does actually, because it brings this forward a little bit and pulls this up at the same time. So it really does. I'm actually excited. I think he's going to like this. Actually, it's one of the best changes. He's going to start to feel numb.
Are you doing fillers? Yes, guys, we are doing fillers.
So what we're doing right now is just doing some base structure. We're going to laser him in this week. So the fillers to give him some good structure, just some sculpting, nothing crazy. And then a laser is going to improve a lot of the wrinkles, a lot of some of the issues he's describing with skin sagging, and just to make him overall look better. And again, look at that. Not elevated, not feminine. Looks more natural. So now, even though I always teach don't directly inject folds, he has the type of folds we do want to inject so slightly. So we're going to still build just a little bit more above.
Someone's asking, do we perform thread lifts? Yes,
Yeah,
we
of
do,
course.
guys.
Different types.
We do all different types. We do even do our Dr. Emer special mega lift. You should go to our IGTV and our YouTube. Check that out. It's really fun to watch. Can you get fat out of your body? Yes, guys, we do liposuction.
We just did today.
We did today. Check out our stories. Check out our IGTV. We'd love to show you guys that. And tomorrow we are going to have another case.
Oh yeah, it's gonna be a great one. Everyone's wanting to join in. They're excited about it. Okay, so now if you see, I just softened the fold. Look at one fold versus the other. You can see it a little softer.
Wow.
Okay, see the depth. Radius is really good at lifting. Again, remember, we don't want fake look. We just want improvement. Again, we're going to go right in that fold. Just so you guys know, I've been injecting Radius for 15 years. Literally.
People asking about the results. Guys, we'll show you before and afters. If you follow us, we love to post that kind of stuff. Stay tuned. We will show you. We'll post stuff on our stories, our feed, our IGTV. We'll make sure we keep you updated. Is he getting Botox? Someone's guessing.
He is, but we're not going to do that live.
We're not going to do that live, guys.
We're doing just the fillers right now. I'm just trying to get the most areas that we can of sculpting for them. We're also going to do a little bit of jawline support on the edge here and just a teeny bit in the back Like I said, he really needs more tightening than anything, so I don't want to overdo the angles. You don't want someone to look heavier, let them look more lean, actually. So just a small amount at the 90-degree angle. And then the big thing is we're going to do some lips. That's a big thing for guys because it needs to be done well. So you guys can see we lifted this slightly, which improved the eye. Now turn it a little this way. There you go. Great. And again, we don't want to overdo this area. But I do want to give him a little bit of that 90-degree angle. You guys can see, take a look, you're really starting to see it come in. What do you guys think? It looks better?
Yeah.
This looks good? I just want to do a little more to this bowl, just a little bit. And a little bit more to lift the tear trough slightly. Good. And again, like I said, this little area, if you really want, I can show you aspiration. Take a look.
Everyone loves to see
Nothing
that.
happens, see? But I really want this to fill out a little bit so the brow gets lifted. Excellent.
If you give him Botox in his laugh line, can he smile?
No. That's why we're not gonna do it. You do not inject the laugh line with Botox. The laugh line is to laugh. You don't wanna stop someone from laughing. And you guys can see, so that fold's better. I wanna get a little bit more into this fold. That's something I think that's just more noticeable for him. Perfect. And then right over here, do another one, deeper injection there. I'll aspirate for all you guys watching. Take a look. Nothing happens. Because we're on bone. But we're filling it out. So now I'm going to do, perfect. So I think that's a good structural improvement.
Why radius and not voluma?
This will last longer for guys and it gives more structure. I'm gonna do just a teeny bit for the eye. Like I told you guys, we don't like to do a big amount right directly on the trough or above the trough because there's just, it tends to not look as good. Hold on, that's okay. We'll replace that, hold on. This one, you can get me one more of this. Sometimes the needle tip breaks. Not a harm to anybody except for filler itself. Okay, what did I say? Great. So I always tell people if that ever breaks, it's a very expensive moisturizer on your skin. And that can happen. So we'll do just a teeny bit to the under eye. You don't want to do too much. The opposite side. Same thing, we gave support to the cheek, you guys. Now we're doing a little bit of support to the trough, but not too much. Like I said, we just want improvement above the trough. There could be a lot of swelling.
Can eye fillers cause blindness?
They can, actually, yes. Any filler can cause an issue with blood vessels. But you guys, this obviously isn't common, and let's not scare people.
So it said all lines disappeared, results are instant? Yes, guys, filler.
This way a little bit, I'm gonna show people. So now we're gonna start, I call it the string of pearl technique, but this is what's for tech neck. I'm gonna fill out one of the folds so you guys can see. We're doing little baby injections here. Now with this filler, specifically bilateral, you want it really superficial, okay? These are some scars he has here, so we're treating those.
I had a surgery there.
Oh, you did? Okay,
Yeah.
so that's why I'm going on there, so that helped, good. And just gonna get basically a couple, all these little spots. Now he's gonna laser later in the week anyways, and it's gonna improve these. But the volume of them need to also be addressed. And so here we are putting some filler in here in this technique.
Are you going to do radio frequency for lifting and tightening?
Not right now, we're doing the fillers. Carefully leave these there. This you have to use this in Pore. Where's the other material? Another one they were bringing in. They were bringing me anymore. So start with a Q-tip. Alright, I'm gonna start your lip. So you're gonna feel a little bit. Now his lip, this is where we wanna be careful, you guys. We want it to all look natural. So I'm gonna start with the lower. This is called velour. This filler is a softer filler that lasts a little bit longer. I like it because a little bit goes a long way. And honestly, we don't have to do a lot for you to see the outcome. Okay, and then his upper lip, we have to be really careful. We just want to at least build this Cupid's bow so you can see his upper lip more. Sorry. And focus it on, okay, this midpoint, good. Come to the other side. Same thing, you just, as we get older, like I said, your lips tends to cave in, and you don't want to overdo the fillers to pull it out. Doing great. One more bad one. Now the thing about velour that's really cool is right now it'll look away, a certain way, and then in about an hour it changes. Again, I'm going to use this to lift the edge in the middle. Excellent. And we're just he naturally has pillars, so we're going to define those a little, just a little bit, because that will give him some support on his lip. Good. Okay, take a second. Breathe.
You're doing good.
Breathe through it.
It's hurt, really.
It actually looks really good. And again, I want to build out this lower part just a little bit more for him. The proportion of lip should be 2/3 to 1/3. Okay. Go to the opposite side. Almost there. He's doing great. His tears, okay? I'm just gonna build this side just a little bit more. What are they saying, Jordan? Are they saying anything?
Someone's asking about his pain level on there. People wants to wave at them.
I'm okay.
And he's surviving. Okay. And then again, he has some little scars, and he doesn't like this lip corner as much. So I want to make sure we have some support around the lip corner.
How long is this? Are these fillers going to last him?
This will last at least a year. And I like it because it's a little softer, and like I told you, in a couple minutes, it's actually going to change slightly. Look at the lip already, it looks great. You guys can see the difference. And again, I'm going to do a little bit more to the lip corner, just so he can get this kind of pulled up a little like he was asking. And then the last thing I'm going to do is fill out this side of the neck. So we did You can see here, look at the one side, this side, and then look at this one. Big difference. So turn down to the right. Good. And then again, very important to do this specific technique with this filler. A lot of people are doing this dilute injection technique on the neck, and it doesn't last. We did this years and years ago. I know everyone thinks they make things up and they're new. You can always come back in style to close. It's already been done. So this is a technique for so many years that we perfected that works better than any of the techniques that are currently out there. And again, doing the most that I can. The filler we got. And this will be great. Turn a little bit more. I'm gonna come back and leave a little bit further, you guys, because the folds extend back. Good. Okay, we'll come back to the other side, put the Q-tip on that side, and then we'll be done. Turn this way. Good. So we use a little bit here on these lines. What are they saying about tech neck treatment?
What other ways can we treat tech neck? Is it only fillers or what?
Lasers, threads, fillers, Botox.
Someone's been watching the whole time and says he looks 10 years younger already.
Good. That makes me happy. It's a long life. Doing a lot of stuff. Okay, come back. So these little bumps will go away in the next few days.
Several people have been mentioning Botox, guys. We're gonna do Botox. We are not gonna do it on live.
Don't worry, he's getting Botox. I know.
Everybody's very concerned about his Botox treatment.
Not even Botox.
I must really need it.
I don't know.
So let's know the age range for our patient.
It's up to him.
I'm 54.
He's in his 50s. Okay, well, I want to do a reveal in a second. We're going to do, you guys know what it is.
We're gonna give the patient the
We're
phone.
gonna do what's called an Emer reveal. So we're going to do it and tell him.
All right, guys, we're gonna give our patient the phone. We're gonna turn to selfie mode. You guys are gonna get to see him, and he is gonna see you guys in the comment section.
No.
I'll do it in a second. I'm going to use the last syringe. I was going to do it on sculpting, but I will. We're going to use for some of the acne scars that he has. Some of these on the neck, but mainly the ones up here in the temple and on his left cheek. So you guys can see we're using a filler called Bellafill. Comes more superficial. And we inject it right under the scar in the blood like that. And it fills those out. Look. Now this filler is permanent. So this one, you need to know what you're doing. Radius is semi-permanent, meaning it's there, but it slowly dissolves. This one builds collagen over time and specifically fills scars. It's actually the only FDA-approved scar filler on the market. Now we've also used silicone for permanent in the past, and people also do fat grafting. So you see it has this right here, this scarring right here. So our goal is to subside this a little bit. Sorry if that hurts a little, I'm sorry.
Nothing hurt after the lips.
I know, once you've done lips, you never, nothing. That's why I do it last. And a lot of the scars you guys saw here before, look how much better they are already. Another needle, move on.
Someone wants to have a Botox party with you. No guy. So what is this, guys? This is male facial sculpting. We did dermal fillers, several areas of the face. We also did the lines in the neck for tech neck.
And now I'm feeling like some of the scars, look, you can't even see that scar anymore.
It's amazing. Had it since a teenager.
Wow. Well, I'm hoping that this makes a big improvement here and stays that way.
Can fillers help the 11th line?
Yeah, but Botox is the initial treatment
Oh,
there.
okay.
And then we can decide if it's something we need. So that scar has been there a long time. Okay, come over here, I'm gonna switch with you. Here. That scar has been there a long time, so this filler will be able to fill this out, so it's really good. You guys can see a lot of these scars have improved dramatically.
So let's see, how long can this last, guys? This will last about a year for him.
Not the Bellafill though.
The Bellafill will last, Bellafill's permanent. The other fillers we did are gonna last about a year. What is his bruising gonna be like? Is he gonna have
We
any?
will find out. Most guys with thicker skin like him tend to not have a lot of bruising, actually. They bleed, but they don't bruise. They have much thinner blood for some reason. See, we're going right under that scar, subcising it. I want to get one or two of these scars.
Someone said, please let the patient know he looks amazing.
John,
I told you the patient, the viewers will hit on you.
all right, you guys. That's it. We're doing that subcision here. Okay. So let's give him the camera.
All right, so I'm gonna flip the camera around. We're gonna give it to our patient. Here you go.
Now we're gonna give you the phone. So this is an Emer reveal. So you look at it yourself. You tell me what do you think after looking at yourself. So now take a look. A little bit of jawline, chin softening, temples. I don't know if you even noticed it, but it's hard for you to see. But the scarring
Yeah,
is
it's so much
basically
smoother.
much better, and there was a big indentation. A little lifting through the cheek. We softened the folds and lips to make them a little better, and under eye. And then the neck you won't see as much right now, but look at the scar on that side. Let's see if you can see it. Take a
I
look.
can't, well, I can't.
That's good. That's what we want.
Now my chin looks so much better.
Yeah, and then when you
Lips.
turn this way, you could see much more on the jawline, the lips, softening of the folds. What did you want to get out of this?
Yeah, no, I wanted to,
Just look better.
yeah, because like I said, I hadn't shaved my beard for 30 years, so I had no idea what was under there.
This is
And I was
unbelievable.
horrified about how small my mouth was and how weak my chin was.
And now I feel like you
Looks-
just have like enhancement,
Yeah,
you
so
know?
much better.
Will you give him the mirror? Let's switch it back. So look at the mirror, because the mirror looks different than the phone. But everyone looks on their phone, so that's why I showed. Now take a look in the mirror.
Wow.
So a little on jawline, little through cheek, softening of folds, a little eye, scarring, much improved. Look at that.
It's a huge improvement. Now I was embarrassed to walk around after I shaved.
I don't think
the
you need
other
to be
day,
anymore.
so now I look.
So that's
I
a
feel like I look
successful
alright.
male facial sculpting, guys. Full face contouring, including neck, including structural changes, scarring, and also just fine improvements of the under eye and folds. And don't forget lips, because as we age, we all lose volume there. So that's it. You did great. Thanks, guys.
Perfect.
I'm gonna do good.
Yeah. Yay.
Yeah.